Have you ever been sitting quietly reading a book or watching TV when suddenly your heart feels like it just skipped a beat? Maybe you dismissed it. You told yourself it's just stress, it's just anxiety, it's just part of getting older. Most doctors will tell you the same thing. It's harmless, try to relax. But what if that advice is profoundly wrong? What if the anxiety, the fatigue, and the heart palpitations you feel are not just psychological symptoms? What if they are physical injuries? I'm Dr. Reid, and I've spent decades bridging the gap between cardiology and functional medicine. My core belief is simple. Your body's systems are interconnected. And today, I'm here to tell you the truth that modern medicine often misses. Stress isn't just a feeling, it's physical heart disease. The constant surge of stress hormones is actively eroding your heart's ability to function. It's making you vulnerable to dangerous conditions like atrial fibrillation and sudden heart attack. I'm going to explain the precise, verifiable science behind this physical damage. But more importantly, I'm going to give you a simple 5-minute tool, a non-pharmaceutical cure that can immediately put the brakes on this internal damage. Stay with me because taking control of your heart begins with understanding your mind. You may have heard of cortisol. It's known as the stress hormone. But don't think of it as a helpful tool. Think of it as your body's nuclear fire alarm that never stops sounding when you face danger, a true threat. Cortisol floods your system to prepare you for fight or flight. This is a good thing in the short term. It gives you the energy to survive the crisis. But for millions of seniors, this alarm system never shuts off. We live in a state of chronic, low-level stress, from financial worries to political news to simple grief. And this constant activation is where the physical damage begins. The continuous presence of cortisol in your bloodstream is a direct attack on your cardiovascular system. It's not just an emotional drain, it is physical erosion at a cellular level. Here is the precise mechanism. Cortisol increases the responsiveness of your blood vessels to other powerful hormones like epinephrine, leading directly to elevated blood pressure, often called stress-induced hypertension. This constant high pressure is the first form of physical wear and tear on your vessels. But the real silent danger lies in the chronic inflammation it generates. Chronic high cortisol levels also increase blood sugar and promote the production of inflammatory proteins called cytokines. This combination creates the perfect storm for chronic systemic inflammation in your arteries. Imagine the inside of your arteries as a delicate, smooth pipe lined with specialized cells known as the endothelium. Chronic inflammation is like constantly sandblasting that pipe's interior, damaging the endothelium over time. This damage makes the arterial walls sticky, which actively encourages LDL cholesterol, the bad cholesterol, to embed itself in the arterial wall and oxidize. This process promotes the buildup of plaque deposits, which is the definition of atherosclerosis, or the hardening of the arteries. It is cortisol damage to heart tissue that lays the groundwork for heart attacks and strokes years down the line. The sustained elevation of these stress hormones can even lead to tangible changes in your blood's ability to clot, making the blood stickier and further increasing the risk of a major cardiac event or a stroke. You are not just feeling tired because you are getting older. You are often tired because your heart is working overtime against chemically constricted blood vessels and your entire body is in a state of constant, low-grade cellular warfare. This is a profound physiological toll, and it's essential that we recognize and address this physical damage caused by the unseen stressor. This chronic internal alarm system also wreaks havoc on your heart's electrical wiring. For this reason, millions of people quietly search for the same question online. Can anxiety feel like a heart attack? The answer, definitively, is yes. And the danger is that the symptoms are often indistinguishable, leading to either the delayed diagnosis of a real, dangerous problem or unnecessary anxiety about a benign one. When acute stress or a panic attack hits, your body releases a massive surge of adrenaline. This is the fight-or-flight hormone, and its goal is to make your heart pound harder and faster, sometimes causing a sudden and terrifying sensation of shortness of breath. This surge increases what doctors call sympathetic tone. It's the accelerator pedal for your heart's electrical system and your body's overall response. For a healthy heart, The accelerator eventually eases up and the system rebalances. But if you are over 60, or if your heart muscle has already been compromised by years of chronic cortisol exposure, this adrenaline rush can become a dangerous trigger. It can cause what feels like severe heart palpitations anxiety, where your heart flutters, thumps, or skips beats in your chest, often keeping you awake at night. More critically, in people genetically predisposed to it, this spike in sympathetic tone can directly trigger an episode of atrial fibrillation, or AFib. AFib is the most common serious heart rhythm disorder, a condition where the heart's upper chambers beat chaotically, which dramatically increases your risk of stroke fivefold. If you frequently feel your heart fluttering, skipping, or racing uncontrollably, you cannot simply dismiss it as just stress. It is your heart crying out, indicating an underlying electrical instability that chronic anxiety is actively igniting. We must also consider the most extreme, undeniable proof of the mind-body link, Takotsubo cardiomyopathy, which is often called broken heart syndrome. This is not a metaphor. It is a real, measurable clinical condition, most often triggered by extreme emotional distress, such as the sudden death of a loved one, a severe financial shock, or intense emotional fear. What happens is that the massive, overwhelming flood of stress hormones literally stuns or paralyzes a portion of the heart muscle, causing the left ventricle to temporarily change shape, often ballooning out at the bottom. The symptoms perfectly mimic a major heart attack, but when doctors perform an angiogram, they find no blocked arteries. The heart muscle itself has been chemically damaged by the sheer force of emotional pain. This syndrome proves that emotional trauma is so powerful, it can instantly cause temporary heart failure. It is an emergency room diagnosis that makes it scientifically impossible to separate the mind's pain from the heart's function. We must address the root cause, which is not merely the worry in your mind, but the toxic chemical response in your blood that can lead to AFib or even a sudden structural change. The medical establishment offers medication to lower blood pressure or stabilize your rhythm, but there is a powerful tool you carry with you every second of the day that costs nothing: your breath. This is the 4 to 7 to 8 breathing technique, and it is the fastest, most effective way to slam the brakes on that runaway cortisol and adrenaline surge. The scientific concept here is simple and powerful, rooted in ancient yogic practices known as pranayama. We are manipulating the vagus nerve. Think of the vagus nerve as the body's longest, most critical electrical highway, connecting your brain directly to your heart, lungs, and gut. It is the primary switch for the parasympathetic nervous system, the rest and digest mode, which is the direct counterbalance to the sympathetic fight or flight mode. The key to activating this vital nerve is the prolonged exhale. When you breathe out slowly and completely, you are physically pushing on the accelerator of your parasympathetic system. This sustained action stimulates the vagus nerve, which immediately sends a signal to your heart's natural pacemaker to slow down its rhythm. Studies show that slow rhythmic breathing, like the 4-7-8 technique, can dramatically improve heart rate variability, or HRV. HRV is simply the healthy variation in time between your heartbeats. Low HRV is strongly correlated with chronic stress, chronic inflammation, and increased risk of major cardiac events. When you consistently practice 4-7-8, you are scientifically improving your heart's ability to adapt and be resilient to stress. This is physiological conditioning. Here is exactly how to do it. You can do this sitting in your favorite chair or lying in bed. First, breathe out completely through your mouth, making a gentle, audible whoosh sound to expel all residual air. Now, close your mouth and inhale quietly through your nose for a slow, silent count of 4. Hold your breath for a steady count of 7. Exhale completely through your mouth with that soft, drawn-out whoosh sound for a full count of 8. That is one complete cycle. Inhale for 4. Hold for 7. Exhale for 8. Repeat this entire process for 4 full rounds, 2 times a day, every day. Morning is ideal for centering yourself and setting a low-stress tone before the day's challenges begin. Right before bed is absolutely critical, as it is scientifically proven to lower heart rate variability, quiet the internal alarm system, and dramatically improve sleep quality, which is itself a fundamental factor in cardiac health. This technique, especially the long exhale to a count of 8, actively signals to your vagus nerve that the danger is over. It forces your heart rate down, relaxes your arteries, and immediately reduces the chemical fallout of stress, offering you total, free control over your body's most essential systems. This is not just relaxation, it is a clinical practice for cardiac longevity. While breathing gives you immediate moment-to-moment control, we must also focus on repairing the physical damage cortisol has already inflicted and providing the foundational building blocks for a healthy heart rhythm. Here, two nutritional cofactors become critical in supporting heart health and actively combating anxiety. First, let's talk about magnesium. I call it the heart mineral because it plays a vital, non-negotiable role in over 300 biochemical reactions in your body, including stabilizing your heartbeat and regulating muscle and nerve function. Magnesium acts as a natural calcium channel blocker. This means it helps your arteries relax and open up, reducing peripheral resistance, which is essential for managing hypertension and lowering the risk of irregular heartbeats. When magnesium levels are low, a very common deficiency in the senior population, the heart muscle becomes electrically irritable, contributing to frequent palpitations, premature contractions, and other ventricular arrhythmias. For maximum benefit in the context of stress and anxiety, look specifically for forms like magnesium glycinate, which is easily absorbed and known for its potent calming properties on the nervous system. You can also find significant amounts in natural food sources like dark leafy greens, almonds, pumpkin seeds, and legumes. Second, we need omega-3 fatty acids, specifically the EPA and DHA found in quality fish oil. These are not just good fats, they are your body's most potent internal anti-inflammatory agents. They work directly to counteract the chronic, silent inflammation caused by that continuous cortisol surge we discussed earlier. Specifically, the EPA component of omega-3 is a powerful anti-inflammatory agent, while DHA is crucial for optimal brain health and overall nervous system integrity. Omega-3s help to lower dangerous triglyceride levels and can assist in reducing arterial plaque buildup by supporting the crucial function of the endothelial lining. They also play a validated role in improving mood stability and reducing generalized anxiety, directly tackling the psychological component that triggers adverse heart symptoms. Combined, magnesium and omega-3 offer comprehensive support. The magnesium calms the electrical system and relaxes the vessels, while the omega-3s repair the cellular damage, reduce inflammation, and enhance nervous system function. They work synergistically to create a calmer, more resilient heart. A word of profound caution, informed by our clinical experience and fact check: if you are currently taking blood pressure or blood thinning medication, you must consult your physician before starting a new supplement regimen. Taking both magnesium and omega-3 simultaneously can sometimes lower blood pressure too effectively, leading to dizziness, lightheadedness, or weakness. So careful medical supervision is essential to adjust dosages safely. The most important takeaway today is this: the fear, the palpitations, and the fatigue are real. They are not a sign of mental weakness, nor are they a necessary consequence of aging. They are a sign of a very real, physiological war being waged inside your body by chronic stress. For too long, the narrative has been that heart health is simply about external factors like diet and exercise. But the emotional toll of life, the anxiety over bills, the quiet grief of loss, the relentless fear of a fragile future, is the most powerful and undeniable factor. This invisible burden, the chronic psychological stress, is what truly separates a robust, resilient heart from a fragile one. The chronic nature of this stress means that every day you ignore the subtle symptoms, you are actively allowing the slow erosion of your vascular and electrical health to continue unchecked. But now you possess the profound knowledge to fight back. You understand the invisible physical enemy, cortisol, and you have the most powerful free tool at your disposal, the 4-7-8 technique. By utilizing this simple technique twice daily and ensuring your nutritional foundation is strong with foundational minerals like magnesium and omega-3s, you can actively dampen the sympathetic nervous system and boost your parasympathetic control. You can take control. You can regain your independence. You can quiet the noise. You deserve to live without the nagging fear that every racing beat is the beginning of the end. This is your mandate for cardiac longevity. Manage the stress, and the heart will follow. Before you go, I want to hear from you. In the comments below, tell me, which subtle symptom, the unexplained fatigue or the racing heart, did you first mistake for just getting older? Sharing your experience helps us all heal. Now that you have mastery over your breath, the next logical step in protecting your heart is mastering your nutrition. That's why I want you to click here and watch my next video on the 3 essential vitamins that quiet your heart palpitations, science-backed. It is the perfect companion piece to this topic, guiding you on exactly what to consume to nutritionally stabilize your rhythm and further fortify your heart against stress. Thank you for watching, and remember, knowledge is not just power, it is peace. The content presented in this video is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.